Hello, my name is Joyce Gibb, and today I would like to talk about a once rare but now once very common GI disorder called diverticulitis. This is also part 1 of a part 2 series. The information I have here today is from Gastroenterology 2019, volume 156 by Straight and Morris. It's a really good article, 16-page article that was very comprehensive as to what diverticulitis is. So if you look at the colon, diverticulitis more often happens in the sigmoid colon, which is the last part of the colon before the rectum, and that distensibility makes little out pouches. So the colon's kind of like a hose, and if there's an outpouching, they're also called pockets or tics. And the outpouching is diverticulosis, and if there's inflammation in those outpouches, that becomes diverticulitis or inflammation. So, but the prevalence of this started pretty much, they feel, in the Industrial Revolution, and there was a hypothesis that the diverticular disease resulted from a low fiber diet. And this theory led to small caliber stools, so they're very, small in diameter. They felt the colonic pressures were increased, and then there was herniation of the colonic mucosa, and then these little outpouching happened, or tics happened, and then you end up getting diverticulitis with inflammation of those outpouches. So the previous theory, they felt like the stool that was in this part of the colon, mostly the sigmoid colon, became, stasis, or it stuck there. And then that stasis usually led to trauma and then ischemia. This was the theory, several years ago. And ischemia means tissue death. Like when you have a heart attack, you have a heart ischemia when that blood clot happens in the heart. Now, this ischemia they felt was because of the trauma that happened with diverticulitis. So the treatment before was fiber deficiency, even though they felt like fiber caused the problem, but that was the treatment, and then antibiotics and surgery. So those were the primary treatment strategies, and this was several years ago. So, but the past 2 decades, or like 20 years or so, there's been a resurgent interest in diverticular disease. And now we have more modern imaging, CAT scans, and flexible endoscopy, or looking at the colon with a colonoscopy, better imaging, better diagnostic tools, which leads to a more accurate diagnosis. So one of the things that has been proven, that diverticulitis is not a progressive disease. And that is what they felt, the reason why they did surgical interventions. If you had more than 1 or 2 in a year, then they felt like that was going to make the colon worse, and they would take that part of the colon out. But they have felt now that this is not a progressive disease. Diverticulitis doesn't lead to more disease states. So a lifetime risk, this is old statistics. Years ago, they felt like somebody that had diverticulitis, they would have a 10 to 25% chance of reoccurrence. But now with the endoscopy, the good colonoscopies and the CAT scan, they feel that diverticulosis now turns into diverticulitis only 5% of the time. It's more common in men than women until the 6th decade of life, and that surprised me, because after age 60, you usually see it's more common in women. In the United States, the prevalence of diverticulitis is higher with whites, 62 out of 100,000 people. These are all out of 100,000 people. African American and Hispanics are 30 per 100,000 people, and Asians only 10 out of 100,000 people. Urban areas, low income, and educational levels, those patients are more likely to be hospitalized with diverticulitis. So what's the progression of the disease? So progression means like what can happen if this continues. And diverticulitis complications occur in 12%, only 12% of the patients. Still seems like a lot when you're in pain. But the most common issue is abscess, and that happens in 70% of the patients, followed by peritonitis and then a fistula. And so a fistula is a connection between one organ to another, and usually the fistula happens between the colon and the inside space, which is your peritoneum. Then that can leak into there and cause disease too. So patients that have recurrent disease happens 8% of the time, and after a complete recovery, and somebody that has within 10 years, they will have a 20% recurrence. So still, even after complete recovery, you still have 20% reoccurrence within 10 years. So, the reason why they initially, like I said, this was the complicated disease, they end up doing surgical intervention with antibiotics. And the risk of that, of course, is, surgical complications and resistance to antibiotics. So that was pretty much, been reevaluated. So what are the risk factors? The risk factors for diverticulitis is a Western diet. And I always call it a SAD diet, standard American diet. And the Western diet, increased meat consumption, increased fats, and high refined carbs. That's a risk factor. Obesity, central obesity, smoking, especially with complicated diverticulitis, NSAID use, which is, any non-steroidal anti-inflammatories, not specifically aspirin is not included in that, but like Aleve, Motrin, those type of things. And then if you have consume any kind of opiates, and then steroids, that's also a risk factor for complicated disease. And they also associated a low vitamin D level with increased risks. So those risks, again, are something that are modifiable. They're risk factors that can be changed. So what are reduced risk factors? Increased fiber intake with fruits and vegetables and whole grains, nuts and seeds. Formerly were felt to increase the risk, but they do not appear to increase the risk in a large prospective cohort study. And then nuts and popcorn were associated with decreased risk with diverticulitis. Now, I just was with somebody, one of my daughter's friends a week or so ago, and he had recurrent diverticulitis, and they told him no seeds, absolutely no seeds. He wouldn't eat vegetables, he wouldn't eat nuts, he wouldn't eat popcorn. Now I could see those things, but any kind of live whole food he was not eating. And that's not good. I mean, that actually will make the risk factors increase. Physical activity, like running, active physical activity, walking, that decreases your risk factor. And then also being under 40 decreases your risk, but that is also increasing. So people under 40 are actually getting more diverticular disease. So if you'd like to speak about this further with me and listen to the next part 2, I will tell you more specifically how we can help prevent recurrence and do something else about this to help you feel better. So give me a call, and I'd be glad to help you on your journey to health. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.